All of these active shooter tragedies are difficult to watch as they're splashed across our TV screens and social media platforms. But I think all of us are a little more horrified when they involve children. On Valentine's Day 2018, our screens were filled with the devastating images and news of another shooting. This time, it was Marjory Stoneman Douglas High School in Florida. Here to provide key details and lessons learned is IFF Local 3080 President Brian Powell and the Fire Chief for the Coral Springs Fire Department, Chief Frank Dominick. Before they come to speak, please turn your attention to the video screens.
Good day, everyone. I'm Kristen Dahlgren in New York, and we are coming on the air at this hour with news of a school shooting in South Florida. This took place in Parkland, Florida, at Douglas High School.
Police and sheriff's officers responding to the area, as well as fire and EMS, and we are told medevac helicopters may also be inbound shortly.
I have the gunshot victim. He's by the entrance on the west side of the school. Does he know where the shooter is? We don't know, but we're entering the building.
A sea of backpacks abandoned on the ground. Emergency vehicles rushing to the scene. Paramedics in a race to save the wounded.
We are getting reports on Twitter and elsewhere that individuals are inside the school tweeting that they are in hiding.
A heavy presence there of first responders trying to assess the situation and aid those in need at this point.
Just before 4 p.m., the 19-year-old suspect captured and taken into custody.
Here's what we know at this hour. At least 17 people have been killed, students and adults. At least 15 injured, and the shooter is in custody.
Good morning, and thank you for having us here to speak with you. On February 14, 2018, the communities of Coral Springs and Parkland experienced the 9th deadliest shooting in U.S. history at that point. Unfortunately, that's been surpassed. And the 3rd deadliest school shooting in U.S. history. These types of events have a great and long-lasting effect on our communities and our responders. We're here today to talk to you a little bit about what we went through and the collaboration that was used to help our members get through this very, very difficult event. As we do this, we dedicate this presentation to all the victims of February 14th, the friends, the families, the caregivers, the first responders, fire EMS, law enforcement, and medical workers that were affected by the events that took place. We hope that something that we tell you today or talk about today can help you better prepare in your community's time of need and better prepare, help serve your organization and your members. As we look at an event like this, preparation is one of the key elements to something that happens within your organization. Whether it's a child that had a drowning or fatality, a member with a serious injury, or even a member that unfortunately has a line of duty death. Preparation is something that is going to get you through these types of events.
Yeah, and like the chief said, the preparation. We've been fortunate in our community. Coral Springs, we service Parkland. Parkland's a small community. The Coral Springs Fire Department, we have a great relationship with our police department. We had practiced the active shooter stuff. We've done the RTF training. So we were as prepared as you could possibly be for a day like this to happen. Unfortunately, it happened, but like has been said a lot of times tonight or today, this is going to happen, and it's going to happen again, and maybe in one of your areas.
As was talked about before, the relationships that are in place ahead of time are a key element of how you're going to respond to and work your way through a situation like this. When you have a large-scale event that takes place, and you've heard it already, this isn't something that you can or should try to tackle alone. You need as much support as possible, and we'll talk more about that in a little bit. One of the things that we're very, very in tune to is mental wellness. It's something that we pay a lot of attention to, and luckily or fortunately, we paid a lot of attention to prior to February 14th. We had a lot of processes, and we had a lot of relationships, and we had a lot of resources in place ahead of time. But the one thing that I really want to get across is when it comes to mental wellness, it's not one size fits all. What works for Brian isn't going to work for me. What works for me may not work for somebody else. So you have to have a large variety of resources available to your members that are going to work for them and their families.
What was interesting after the event as we were going through the peer support stuff is the different response we were getting from people. We were hearing from members of the Coral Springs Parkland Fire Department that they loved hearing or being counseled by members of their own department. But then you'd have another station would say, oh, it was fantastic, I didn't have to deal with anybody I worked with. I could deal with somebody from a neighboring community. And then we had a whole nother group of people that were saying, I don't want to talk to anybody that I might see at a hospital. I don't want to take a patient to a hospital and run into somebody who's a peer supporter and was helping me out. So kind of maneuvering through that issue going forward was extremely difficult, and still to this day is difficult. Of when somebody's looking out for help, who do you want to talk to? Is this somebody from Metro-Dade County? Is somebody from Palm Beach County? But these are some of the issues that we ran into.
And that was something that was very helpful, was having that large area of resources and the types of resources. But one thing I will kind of warn you on is make sure you know what those acceptable resources are ahead of time. You'll have people that want to come out and help. You'll have a ton of people coming from the community, but you don't want to deploy resources that you don't know about and haven't vetted, because in those cases, sometimes they can do more harm than good. So you kind of have to have that figured out ahead of time, what your acceptable level of resources are. So I just want to give you a brief summary of what took place and what was being dealt with on February 14th. In total, 17 students and staff were killed in Marjory Stoneman Douglas High School. The Coral Springs Parkland Fire Department, as well as a lot of mutual aid units, responded to this call, and we transported a total of 19 patients to local hospitals. The 19 patients that we transported were all gunshot wound patients, and when I say gunshot wound patients, they had multiple gunshot wounds from a high-power rifle at close range. 2 of the 19 that we transported, unfortunately, were expired in the hospital and declared deceased. The other thing I want to really reiterate is the shooter was only on campus for about 8 minutes total. He was only shooting for approximately 3 minutes. These events are very short, typically in duration, but the effects of these events go on for a long time. We're 18 months post-Douglas, and I can tell you our union president, Steve Cross, is sitting in the audience, and Brian. We're still dealing with this on a daily basis. There's not a day that goes by since this took place that we are not dealing with some aspect of the events that took place on February 14th, whether it's with our personnel, it's with our community, it's with the school system itself, the parents of those that were either killed or injured. So although these events take place in a very short period of time, the recovery is really spread out. And I talked to the folks up in Orlando, and obviously with Pulse Nightclub, they're almost 3 years now post, and they're still dealing with those events. So this isn't something that goes away in 6 months or a year. This is something you have to have long-term plans in place, and we'll talk more about that.
And obviously, multiple gunshot wounds is hard to deal with. And this is the importance of getting with your law enforcement, training on the tourniquets, the blood clot stuff, and the chest seals. I don't know that a single one of our paramedics or another one of the agencies, Chief, you would know better, actually applied a tourniquet to any of the patients. Every single patient that came out of that building who was viable. We had one child, a 15-year-old boy, who was shot 5 times with an AR-15. He survived. And a lot of that had to do with law enforcement and training we had done with the LEOs to put the tourniquets on the wounds. They actually saved many, many lives that day.
And that's a great point. In 2015, we actually started our active shooter training programs jointly with our police department. So we had trained almost 3 full years prior to this event on not only joint response, but training with the police department on how to use stop the bleed type of procedures. The mental wellness response to Parkland was determined well before February 14th. This goes into that training and preparation, making sure you have policies, procedures, and resources in place ahead of time. If you think you're going to be able to come up with a plan at the time of something happening, you're really going to be selling your members and those that you're responsible short. So the actual response to these types of items, these types of incidents happen well before the incident itself. Since February 14, 2018, the Fire Department, the Florida Firefighter Safety and Health Collaborative, the IFF, Local 3080, the Coral Springs professional firefighters, in the city of Coral Springs worked collaboratively together to provide every and any resource available to our members and their families.
You know, and the chief, a lot of collaborative has been thrown around here. What we were able to accomplish, and we'll get into it on another slide, was the fire chief. When this went on, I responded to the scene and I went to the fire chief and I said, I'm going to implement I'm going to call some peer support teams. He said, go ahead, do it. We just want to make sure we're on the same page. We had talked about the union setting up its operations at our union hall, which is about 15 miles away from our public safety building and about 12 miles away from the incident. But we got together on the scene and later at the CISM, and we decided to create one command post at our fire administration building so we could all be together so that we could do this. And I think that was certainly a key to us being able to accomplish what we were able to accomplish in some of the other slides you'll see.
So together, as Brian said, we set up a unified command post at fire administration. General President Shapeberger was there, and we truly appreciate you coming on scene and providing everything, and all the resources. The IFF and all of your staff were tremendous to work with. And that unified command post stayed up and running for 60 days post this incident, and it was dedicated to mental wellness. From that, peer support teams and members from all over the area came together. We had a meeting on Thursday, and by Friday morning, we were deploying these teams into the field.
And that's the amazing part. So at 2 o'clock on a Wednesday, the shooting started. By Friday morning, we were by 8 o'clock in the morning, the peer teams were going out to the fire stations. And that, if it wasn't for Pat and Jim, we all know the names, General President and the GST coming down, and just the resources that came in. Here's where the peers are. Orlando was in, well, Boca. We couldn't get hotel rooms because the FBI takes all the hotel rooms. But we had Orlando there that night. We had FDNY, and it was just absolutely amazing what this IAFF was able to do for us.
So just to give you an idea of what took place over the next several days, working with the IFF and the Florida Firefighter Safety and Health Collaborative in the city, we were able to basically visit close to 600 firefighters in the following couple shifts of this incident. And that included 29 stations over 9 different agencies. We didn't just visit the firefighters that responded to the scene. We visited the shifts on each side of those firefighters responding to the scene, because as you know, when you go back to the station, people talk and they're exposed. Maybe they have kids, maybe they had calls prior to this, and this was a trigger for them. From those responses, we were actually able to identify some folks that were in need of follow-up and additional help, and plans were in place to continue those follow-ups and that support well beyond the incident.
And another key, I think, to us moving forward was the Florida professional firefighters had committed to sending at least one person from every fire department in the state of Florida through the IFF Peer Support. Within a month or a couple of days after, I think 32 days after the actual shooting, we were able to have a peer support class at our union hall for the agencies that responded, so we could get peer support people into the fire stations so we keep more of an eye on each other. I think that has been a monumental benefit to our people, because that's we're actually getting feedback from that. Somebody who went to that class. We had dispatchers in that class because we wanted to make sure the dispatchers, some of the stories that dispatchers tell you, we see it, they hear it, and it was just horrible. So we felt it was important to even get the dispatchers, and the International embraced even bringing in SWAT medics, SWAT team members, and the dispatchers.
One of the things that we talked about very early on collectively was the ability to give our members a chance to process what just took place, and I think that's very important. So we sat down and we committed to our members that anybody who needed a mental wellness day, no questions asked, please take it off, go be with your families. It wasn't charged against their vacation time, their sick time, or anything like that. Within the first 30 days of the incident, anybody who needed that time off was given that time off, no questions asked. And that was something that we got a lot of feedback from our members that was very valuable to them. One of the most important things you can do is try to get closure on these incidents. And that's what we were trying to accomplish, was allowing our members to start the process of healing and work towards closure. Brian touched on this already. We visited all the groups. So it wasn't just firefighters and paramedics. We talked with law enforcement. We made sure our dispatchers were taken care of. Don't forget about your dispatchers. They hear this stuff, and they don't always get closure to what happened. Have a long-term plan. This was something that was developed within that unified command post, and it was something that was implemented and carried out. We went from the day it happened and planned out a year. We planned visits at 3 months, at 6 months, at 9 months, at 1 year. This involved peer counseling, this involved clinicians, this involved chaplaincy, this involved therapy animals, this involved yoga for first responders, this involved all of that stuff, and it was something that was very appreciated by our membership.
Yeah, and I think just on that point, Dr. Moore touched on this, that it starts today. And it really does start today. If it hadn't been for us having a core group of people in the region, I don't know that we would have been able to accomplish what we accomplished. It just wouldn't have been able to happen as fast as it did. So again, started today. This is when it really needs to happen. And get with the fire chiefs, because it makes it a whole lot simpler when you guys can work together.
The key takeaways that I would tell you is build your relationships. Make sure you're on the same page with those folks that are stakeholders within your organization. Have a plan, exercise that plan, train on the plan, and make sure you have the resources that you're going to need in your time of need. As it was mentioned before, it's not an if, it's when. And it doesn't have to be a large-scale event. It can be any other type of event that's going to affect you, your organization, your community, or your membership. I truly, truly appreciate the opportunity to be standing here with you all today. I truly appreciate everybody in the room that reached out to our organization in our time of need. It was very, very, very helpful and very much appreciated.
Thank you.
Thank you.